Thank you very much, Mr. Chair. Certainly, as a committee with oversight responsibilities, we are certainly concerned that ongoing investigations be pursued, followed, and resolved. I see nothing in the leadership of Director Milgram or President Biden that would suggest that there would not be an open and continuing investigation and abided by whatever the resolve is. I think it is important in this hearing to emphasize the cruciality of the work of DEA agents, and having worked with them for more than 2 decades in terms of as a member of this committee, I know that their work is sincere, their competence is at the highest level, and they fight every day to protect the American people from the scourge of drugs. I wish we could do something directly, even maybe, Mr. Chairman, with a magic wand, to deal with the demand that continues to possess those who see profit around every corner. And so this committee deals with the issues of crime, but I have been here long enough to realize that as we began my tenure in the United States Congress, crack, cocaine were the kings. And no one was paying attention to any of that but the DEA, because it was in communities, unfortunately, that were at the lowest level in many instances of poverty, particularly crack. Only to the opioid epidemic did we find common ground. I think it is important to find common ground now because your concern is my concern. So let me begin by acknowledging Administrator Milgram as the head of the DEA. You face the Herculean task of managing the flow of illicit drugs across our borders, coping with the impact of newly developed drugs, and addressing the concerns of the public health crisis of substance addiction and abuse. With the administration's whole of government approach, your agency stands at the epicenter of the storm. This is, at the least, the 3rd hearing this year where fentanyl policy will be a major subject of inquiry. As a likely byproduct of interruptions in treatment, recovery, and prevention services and stress induced by the unprecedented COVID-19 pandemic, fentanyl and fentanyl-related substances have emerged as the nation's deadliest drug threat. And might I add, the impact that it is having on our youth, with the misrepresentation of pink pills being what they had heard they were, but now they are immediate death sentences, immediate. Fentanyl is a major contributor to the ongoing opioid epidemic, leading to alarming increases in overdose deaths. With nearly 300 people dying each day of drug overdoses, no community is safe. The Centers for Disease Control and Prevention has reported that fentanyl-related deaths accounted for more than 70,000 of the 107,622 overdose deaths that occurred in the U.S. in 2021, continuing a 2-decade-long trend of increasing overdose deaths. In my home state of Texas, fentanyl was linked to more than 1,600 fatal overdoses that year and more than 2,000 overdose deaths in 2022. Nationally, more than 2/3 of the reported 107,081 drug overdoses deaths in 2022 involved synthetic opioids, primarily manufactured fentanyl. Despite a slight decrease in 2022 from the previous year, fentanyl overdoses remain the leading cause of death for adults 18 to 45. To the horror of every parent, as I said earlier, teen overdoses have been reported in every corner of the country. To drive home this issue, our March hearing even featured a witness whose child died of a fentanyl-related overdose. According to the CDC, more than 2,200 teens fatally overdosed in the 2.5-year period from July 2019 to December 2021, with fentanyl involved in 84% of those deaths. Given its potency, even small amounts of fentanyl can be lethal, making it particularly dangerous for individuals, especially teenagers, unaware of its presence in drugs they receive from friends or from sources on the internet. Fentanyl and fentanyl-related substances have been found hidden in and mixed with other illicit drugs, such as cocaine, heroin, and methamphetamine. And communities of every kind are being flooded with fentanyl masquerading as prescription drugs. Teenagers are falling victim to counterfeit pills that are highly addictive, deadly, and made and marketed by drug traffickers to resemble authentic, less potent prescription medications. We must do all that we can to break the cycle of addiction and even the needless loss of life of fentanyl and fentanyl-related substances. This includes making sure that the DEA has the tools it needs to perform its vital role in combating the illicit production, distribution, diversion from legitimate sources and trafficking of these deadly substances to prevent their flow into our communities. In addition to working with this crisis of addiction, the DEA works closely with local, state, tribal, territorial, federal, and international law enforcement agencies to target every facet of the illicit drug supply chain and every level of drug trafficking organizations that threaten the health and safety of our communities. By targeting international drug trafficking organizations to dismantle fentanyl manufacturing and distribution networks, the agency works to disrupt the supply chain and reduce the availability of these dangerous substances on the streets of America, from Mexico cartels to Indian and Chinese source precursor chemicals, as well as Chinese money laundering operations that facilitate the cartel's operation. But to truly address this crisis, we must address the flow of illicit fentanyl and fentanyl-related substances into the United States and our communities, while also reducing the demand, which is fueled by addiction to these and other drugs. That is why I introduced H.R. 4272, the Stop Fentanyl Now Act, a comprehensive response to the recent surge in overdoses and overdose deaths that address both the supply and demand for fentanyl and fentanyl-related substances. I encourage my colleagues to co-sponsor. Relying on a whole-of-government approach, my bill integrates law enforcement, interdiction, public health initiatives, prevention and treatment, and public awareness and education. The agency also performs a vital role in educating the public about the risks associated with fentanyl and raising awareness about the potentially fatal consequences of its use. The outreach includes efforts directed at teenagers and young people with a focus on prevention and deterring experimentation. Director Milgram, I hope you can expand on the DEA's One Pill Can Kill campaign and discuss its impact on targeted groups. As one advocate said recently, community outreach must be outside the box, while another pointed out that there is no comprehensive education, prevention, or early intervention happening at the federal level or at the state level. The DEA's involvement is essential to enforcing the Controlled Substance Act, curbing the availability of fentanyl, fentanyl-related substances, and ultimately reducing the devastating impact these substances have on communities, particularly among vulnerable populations like teenagers. And statistics have shown that, again, the most incarcerated persons around the fentanyl issue are African-American men. And so we must find a way to fight and fight hard, but we must also find a way to deal with the question of justice. As fentanyl-related overdoses and overdose deaths continue to occur at a frightening pace, and African Americans are becoming the face of a second national wave of overdoses, the DEA is essential to addressing the crisis of addiction, abuse, and overdose deaths. I look forward to a constructive exchange on federal drug policy at today's hearing, and yield back. Mr. Chairman, I thank you, even as we are in our third hearing, for a hearing on this important topic, and I look forward to this committee being enormously constructive in the fight against this scourge and this death sentence for our people here in this nation. Thank you.